Hi, I'm Dr. Rod Willey, founder and CEO of Koala Center for Sleep Disorders. I grew up in a small mountain town in Northern California, the youngest of 3 kids, and my parents owned a carpet business. I started helping my father with his carpet installation at 8 years old. At 17 years old, I met my wife-to-be. We got married at age 20, and I had all intentions of being in the carpet business for the rest of my life. That's when a little bit of tragedy happened. We lost our first child and the opportunity of having any other children. I decided to go back to school, and my wife Donna, she went to work for a dentist, and she would come home and tell me about how great her day was, and I realized that I could use these hands for something besides laying carpet. I was accepted at Loma Linda University in 1981 into their dental program. By the time we were at our junior year, we had adopted a couple of young kids. Donna decided to stay home, raise the family, and I worked 2 jobs. Full-time as a dental student, and also working full-time running a carpet business out of my garage. My senior year, we sold over $300,000 in revenue sales, and I had 1 carpet layer working for me at that time. And when we graduated, I decided to move back to Peoria, Illinois, where we bought a small practice, 2 employees, 1,500 patients, and it was just a 2-day-a-week practice. The practice grew until in 2008, we had 8 doctors working for me, 30,000 patients, and over 75 employees. I become very close to many of my employees, and I know that I can't do anything without them. One of these particular employees became very close to her and her husband. Her husband had had some gum problems and gum disease, and I had treated him for periodontal treatment for 15 years. I was patting him on the back and telling him how great a job he was doing. I had his mouth in tip-top shape. We would go out to dinner with him, great family. He was 51. 2 young kids. He was a police officer, and one night he had worked all night. He came home and went to sleep during the day, kissed his wife goodbye. She came to work for me. At the end of the day, she went home and unfortunately found him dead in bed from an apparent heart attack. It was soon after that I took my first course in dental sleep medicine. And as I was sitting there listening to the presenter talking about the signs and symptoms of obstructive sleep apnea. And then he said something that literally took my breath away. He said 90% of people who die in their sleep due to a heart attack, the root cause is sleep apnea. I immediately thought of Joe. You lose 7 to 15 years of lifespan if you have untreated obstructive sleep apnea. You have a 60% higher risk of cancer if you have untreated sleep apnea. There are a gamut of problems, medical issues that are there, and whatever it is, if you're not getting that good rest that you need, it's going to show its ugly head somewhere. I came back after that experience, and I made a pact with myself that I would never look down another mouth without looking beyond the teeth. I also began training in neuromuscular dentistry at Las Vegas Dental Institute for Advanced Learning. What I didn't realize is my functional orthodontics, the neuromuscular dentistry, and the obstructive sleep apnea all run down the same vein. It has prepared me in such an incredible way to treat patients from 2 to 92. The opportunity that we have in dentistry today is greater than it has ever been in the past. I started seeing sleep apnea everywhere I looked. In fact, we started treating it, and I developed in 2009, developed another company called Illinois Institute of Dental Sleep Medicine. And I realized that there was people everywhere that needed this treatment. In 2010, I got a call from someone out of the blue that offered to buy my large dental practice, and I elected to do so. In 2011, I had an opportunity to start doing some national speaking at some conferences. And as I was talking about how many patients we're seeing and how we're doing these things, there was a lot of deer in the headlights look. And I had a lot of dentists coming up to me afterwards and saying, how are you doing this? How are you getting the treatment? What appliances are you using? How are you actually getting paid for it? And I realized that we needed to systemize this and train people for it. We decided to go on a vacation to Australia. On the way there, Donna and I decided to start a franchise in the business of treating obstructive sleep apnea using dental appliances and also treating oral facial pain. What were we going to name it? We were discussing that as we were on the flight to Australia. We got to Sydney and we went to a hospital for koalas. It turns out these little koala bears, these little critters, they fall out of bed, they fall out of their perch in their tree. They sleep 20 hours a day. And if they fall out, they can land on the ground and injure their shoulder or their hip, and then they have to be rehabilitated. So we were at a koala hospital and we came out of there learning a lot about these little guys, and Donna looks at me and she says, I know what we need to do. Let's call it Koala. Koala Center for Sleep Disorders. We founded Koala Center for Sleep Disorders in June of 2012. Since then, for the last 5 years, we have developed this franchise into what it is today, 19 locations in 10 states. We train all the systems. This is a turnkey opportunity, from everything from training the doctor and the staff, giving them the systems and the marketing and the billing and everything that goes along the way. A great opportunity for many people. You know, when I first started obstructive sleep apnea, I was one person and I could treat a few patients. I've treated a little over 3,000 patients for obstructive sleep apnea personally. But you know, the great thing is, now that we have 19 locations, we can treat this many patients in a year or less. And so what I was able to do, and just by myself, we've been able to make a difference in people's lives all across this great nation. And we are just getting started. The newest thing that we have added is Koala Kids. I've taken a full circle all the way from the beginning of my career, where I began my career doing a 5-year course in guided growth and functional orthodontics, to now developing Koala Kids, where we are doing guided growth in these young kids to correct their airway problem, to correct their malocclusion at a very young age, ages 2 to 15. And we are able to change their stars, eliminating ADD many times, eliminating the inhibition of growth hormone production, eliminating bedwetting, eliminating braces in 90% of the time, and the list goes on and on. I'm very excited about adding this new brand to the Koala Center for Sleep Disorders. So where are we going in the future? The sky's the limit. I envision a day where we have over 300 locations, and we have the team to do it. Come and join us.